It is 1:30 p.m. Pacific Daylight Time. It is the 17th day of April 2025. This is episode 1076 of Bitcoin, and it's an interview show. I have Andy Schoonover from CrowdHealth on with me today, and I'm really happy that he could come on because I had been dying to ask some guys, any guys over at CrowdHealth, a particular set of questions that I didn't think was ever answered on any of the other interviews that I've heard about CrowdHealth. And Andy, being the CEO, was basically in the best position to answer those questions, and he did so. And I can't thank Andy enough for coming on the show and being here with us today. So I'm just going to drop you right into the interview. If you have any questions at the end of the show about where to go find out more information, I will have links in the show notes. If those aren't good enough for you, feel free to DM me on Twitter, David Bennett N as in Nancy, B as in boy, or of course on nostr. I'm NunyaBidness on nostr, so you can get a hold of me there. I will do my level best to put you in touch with Andy and any of his crew that I can, so that you can learn whatever it is that you want to learn about CrowdHealth. It's an amazing service, and it is well worth your time to figure out how we're kind of trying to bypass healthcare. Well, not healthcare, but the health insurance industry in the United States, because it's just become too untenable. And people like Andy are out there trying to give us navigable pathways around it. So without any further ado, here's Andy from CrowdHealth.
Amazing.
And I know I've either talked to you or one of your other crew members at CrowdHealth. I've asked a couple of questions, I don't know, via Twitter or DM or something like that.
Sure.
And so I've talked to y'all before, but you've definitely never been on the show. So welcome to the Bitcoin and podcast. We talk about Bitcoin and other things, and I figure healthcare is other things. So
it's a big other. Yeah. Well, thanks for having me. I appreciate it.
Yeah, it is a big other. In fact, what is it, like a $4.1 trillion industry, healthcare in the United States?
Last estimates for 24 is hitting 5.
Oh, God almighty. Okay, and it affects everybody. So what I want to start here with is I just kind of want to talk about the landscape of healthcare as it is right now versus what it used to be. So what do you know of the history of how healthcare has evolved in the United States? Like, I think what I'm getting at is, like, when I was a kid, there was not really any such thing as health insurance. You just went to the doctor, you just paid. Companies didn't offer it to their employees as a perk. And all of a sudden, the landscape has changed. Mm-hmm. Do you know how health insurance has evolved in the United States, and why are we here? Why are we dealing with this?
Yeah, for sure can talk about that. Are we on now? Are we going?
Oh yeah. Let's roll it, man. Let's roll
it. Okay. Yeah, no, for sure. Health insurance started back in the 1920s, where hospitals basically said, look, if you pay us a monthly fee, we will take care of all of your needs. And so it was kind of a subscription-based service in the 20s. And then, after World War II, what happened is that the government basically put a cap on what you could pay people. So they basically limited the amount that you could pay people. And as a result of that, employers are like, okay, well, if I can't pay somebody in salary, what else can I give them that will, add value to get them to join me, as opposed to, going and joining somewhere else? And so they started providing healthcare. And so this really started in, the 40s. And so that persisted for a while. And then, fast forward, 60 years, Obamacare put that, codified that as an employer, you now must provide healthcare to
Mm-hmm.
your employees. So anybody over the age or over 50 employees now is required by law to provide their employees with healthcare. We also had some steps along the way, which there's the HMO Act, which was in the late 70s, early 80s, not too distant from when Nixon took us off the gold standard.
Right.
It seems like everything went awry, in the 10 years following coming off the gold standard. And, United, Cigna, Aetna, all were kind of the original companies that are now those companies started within that kind of 1975 to 1985 range, with the passing of the HMO Act, which basically, codified insurance as we currently now know it. And so, it has been a number of government interventions that, with the good intent of giving people additional value, protecting them, right? As we always know, the government always says, I'm here to protect you,
Right.
has created this has bastardized healthcare as we've known it. My brother, I was born in the 70s. My brother was born in the 60s. And I think my mom paid something like $95 or something to have him born, for his birth.
Right.
And now the average is somewhere between $15,000 and $18,000, depending upon, where you live. And so it's just been a number of legislative acts over the last, say, 50 years that have created what we currently have within health insurance. And people think this is very, very complex, but I've said before, and I'll say it again, it's not that hard to understand why healthcare has gotten so crazy. You have the sellers of healthcare, which are these big hospital systems. They clearly want the price to go up. They want as much for the service they provide as possible. That's capitalism. I have no problem with that. Unfortunately, the buyer of healthcare is not me and you. We're not buying healthcare. It's our insurance plan that is ultimately buying healthcare. And what people don't fully understand is that health insurance actually has an incentive for the prices to go up also. So right now, there's a legislative act. It went into effect around Obamacare, where health insurance plans are maxed out at 15% of our premiums for what they can use for administrative costs and profit. So if I have $1,000 of premium, the max they can use for administrative costs and profit is $150.
Okay.
So how do they increase profit? How do they go from 150 to 165? Increase it by 10%. Well, your premium has to go from $1,000 a month to $1,100 a month. So they actually want your prices to go up over time so that their 15% chunk of your premium is as large as possible. And if you think about that the other way, which is a little bit more crazy, if it were to go down, let's just say your premium went down 10% from $1,000 to $900. Well, guess what? The amount they can use for administrative and profit goes from $150 to $135,
Right.
which means their profit goes down, which means they have to cut employees. They have to cancel their trips to Cabo for their big executive leadership team meetings.
Right.
They have to start cutting things within the organization. And clearly they don't want to do that. And so they have no incentive for these prices to go down over time. And so that's how perverse it is. If you have the buyer of healthcare, health insurance plans, wanting the price to go up, and the seller of healthcare, which is these big hospital systems, which are becoming more and more consolidated, if they both want the price to go up, as I told Saifedean yesterday on his podcast, it doesn't take a PhD in economics to figure out what's going to happen to the price if the buyer and seller both want them to go the price to go up.
Well, yeah, this sounds like a subsidy mindset. We got agricultural subsidies, and it's destroyed our food. We've got educational subsidies, and it seems to have really done in the higher education system. Is this pretty much the same thinking? Is this just another form of subsidy that's destroying healthcare?
Absolutely. I mean, I think that you have it spot on. I'm sure you've seen the graph. If you haven't, it's like astounding, where they lay out over the last, I think it was 30 years, the inflation in different types or in different kind of subsets of the economy.
Mm-hmm.
It's computers and it's TVs and it's cars and it's healthcare and it's education. Well, guess what is up and to the right? Everything that the government touches is up and to the right. That's education, healthcare primarily. I mean, those two things are massively higher than our base inflation rate. Everything that has gone down is things that you and I purchase out of our own pockets without government intervention. It's computers and food, and all of these things have gone down over time, whereas everything the government touches has gone up over time. And so, I think it's clearly that government intervention, while again with the guise of protecting us, has actually increased our costs for healthcare substantially. And in fact, we pay 2 times what other countries pay for the same healthcare service. Our life expectancy is pretty much flat to now going down, whereas everybody else is up and to the right. And so we're spending a lot more money and getting a lot less for it when compared to other countries. And I think it's a lot to do with this government intervention. The second component of this is that our food system is a total and absolute mess, where our population is about 50% more obese than the other comparative countries. And so, when you have obesity, which is 5 to 10 times more expensive, than someone who's not obese, who's metabolically healthy, that clearly has an impact on the consumption of healthcare, over a period of time. So we've got, obese people within our country, plus government intervention leads to massively high healthcare costs.
Yeah, and I would have pulled all that. I would have pulled on all those strings. But first, before we get any further than this, you started a company called CrowdHealth, and that's why we're here, because I want to know more about what CrowdHealth does, why you started it. So I think the best thing to ask right here is, what is CrowdHealth and how does it work?
Sure. Yeah, I'll give you a little bit of background, just to give you some context. This is my second healthcare company. I sold my first one, and as a result of that, I didn't have health insurance because I was no longer employed by that company. And so, ignorantly, I thought that the Obamacare plan was my only other option. So me, my wife, and my 2 girls got onto a plan. I think it's 11 or $1,200 a month, and I joke it worked until I actually had to use it. My little one was 1 at the time, and she was having recurring ear infections. And so we went to the ear, nose, and throat doctor, or pediatrician first, who said, "Oh yeah, she's got a hole in her eardrum." In essence, what was going on is fluid was building up in her ears, and it popped her eardrum. And as you can imagine, a 1-year-old doesn't take too well to that. And so couldn't sleep, screaming all day long, a total chaos within our house. So we went to the ear, nose, and throat doc, who's like, yeah, hole in her eardrum. She's got to get tubes in her ears, which are these little plastic tubes that enable that fluid to drain from her ears. And so we went and did that. We were in network. We did everything correct. And the health insurance plan came back and said, well, first I got the bill, and it was $8,000. It was a 15-minute procedure, and we got charged $8,000 for it. I'm just like, holy crap, $8,000 is crazy. But I was like, this is what health insurance is for. Like, this is the whole point. And we were at the end of the year, so we had made it most of the way through our deductible already. And so I thought the health insurance plan was going to pay for this. And a few weeks after we had done the procedure, we got a note from our health insurance plan that says it was not medically necessary, and so they weren't going to pay for it. And I was like, wait, hold on a second. Like, my ear, nose, and throat said that I needed it. My pediatrician said that I needed it, yet you guys are saying I don't need it. So, after 2 rounds of appeals, they basically were like, nope, we're not paying for it. And so I had to stroke an $8,000 check to pay for this, ear tubes for my daughter. And I was pissed, as you can probably imagine.
I would imagine.
So I called the health insurance plan. I was like, look, I quit. If you're not going to pay my bills, I'm not paying your bills. And we became, in essence, uninsured. And so my wife looked at me and was like, okay, so, what are we going to do now? And so over the next 12 or 18 months, we try to figure out, like, how do you live viably outside of the legacy health insurance business? And so we realized that we could negotiate way better rates if we were to pay the doctor directly without them having to bill health insurance. I didn't know that I could negotiate with the hospital, so that $8,000 bill I probably could have got down to $2,000, $2,500, something like that. And so I started building these tools to allow me to operate without health insurance. I was like, I bet you other people would like this too. I think, there's a study a few years ago where it's like, what are the most hated industries in the United States? And government was number one. I didn't even know that was considered an industry, but apparently it is. And health insurance and pharma were two and three.
Yep.
So I was like, I bet you other people would want something like this too. And so I started CrowdHealth in April of 21. Actually, yesterday was our 4-year birthday. And in essence, what it is we've gotten a bunch of people together we're at 10,000 members right now who are willing to fund each other in a decentralized way, their health expenses. So, if my daughter breaks her arm and it's $5,000, then CrowdHealth will go to 50 people within the community and say, hey, this guy in Austin, Texas, his daughter broke his arm. Would you be willing to give him $100? And if you say yes, then $100 goes from their account to my account. And once 50 people say yes, I now have $5,000 in my account where I can go and pay for this broken arm directly. And as a result, the doctor is giving me way better rates because he or she doesn't have to go and bill health insurance, which is a huge administrative task for them. In fact, about 15 and a half hours per week is what an average doctor spends fighting with health insurance just to get these bills paid. So if I can pay the doctor directly, he gets the money right away. He doesn't have to fight with health insurance. The doctor-patient relationship is reestablished because you don't have a health insurance plan in the middle. So it's worked, brilliantly over the last 4 years for about 20,000 bills. Everything from little pediatric visits to, we've had dozens of cancer cases and NICU babies and automobile accidents and all kinds of things that we have successfully funded through that decentralized, crowd-funded type of model. So that at a 20,000 foot level is how it works. And, like I said, it's worked, really, really well over the last 4 years.
So it's like crowdfunding only in the specific realm of replacing the defunct health insurance system and the way they interact with healthcare. It seems like a very simple model, but it's solving a huge problem. And you guys have been able to make that work because I've got a note here that says 1 in 5 in-network Obamacare claims are actually denied. That's a 20% denial rate. And with those kind of numbers, you're rolling dice and still you're paying. I've heard numbers anywhere between $900 and $1,800 a month, depending on the package that you get from healthcare.gov. And you're paying to roll dice. That's a lot of money to roll dice and come up bupkis, 1/5 of the time. And so this, even though that I don't like the word crowdfunding when it comes to something as important as this, but you guys have seemed to make that model work very, very well because you got 10,000 members, if I heard you correctly, right?
Mm-hmm.
And you started like 4 years ago. So you guys have ramped up pretty well. And you were talking about like a broken arm, but I've got a CBS article here where you guys were actually able to get a girl a brand new arm because she had it severed, and CrowdHealth did that, and her insurance company wouldn't pay for I'm assuming a prosthetic arm, right? Am I getting close there?
Yeah. So, I mean, you made a bunch of good points, which is, about 1 out of 5 are declined. I unfortunately was 1 out of 5, with my $8,000 bill. Remy, who that CBS article is about, is 1 out of 5. And so she got her bill declined for medical necessity. And so, we have about 200,000 families every year go bankrupt due to a medical event, even though they have health insurance. So as you said before, you're rolling the dice. And if the dice doesn't go your way, then you're toast. And a lot of these people, if you don't have, for me, it was $8,000. For her, it was $24,000. If you don't have that money, then you either have to do without, which, puts you into medical harm from my perspective, or you got to go bankrupt, unfortunately. And, a lot of people don't have $8, $10, $12, $14,000 sitting in their bank account for a medical emergency. And so that those Obamacare plans, from my perspective, are putting these people into medical bankruptcy, which is just an absolute shame. And again, it's two reasons. It's one, really, really high deductibles where you don't have enough cash in the bank to actually pay your deductible. And two, it's because your bills are denied. And, if you go to the ER and you have a $50,000 bill and the health insurance plan denies it, most of us are toast. And they're relying upon something that I don't think is really, reliable. And so, to your other point, yes, we're crowdfunding, and it makes people uncomfortable because the way we've been doing this in the past is like GoFundMe. Everybody knows GoFundMe, and
Right.
people have to put it up on their, social media platforms. And, a broken arm is not like a heart tugger that people randomly are just going to give to you. But what we've done is we've created this group of 10,000 people who've all said, hey, I'll help if somebody has a problem. And the way that it works is when I request money for my daughter's broken arm or my broken arm or whatever, they actually know if I, over the last 10 times, have said, yes, 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 yes to other people, or if I said no, 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 no to other people. And if I've said yes, 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 I've been a good member of the community. If somebody has asked me, I've given. If I've said no, 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 then I'm here to be a taker and not a giver. And so 100% of the time where you've been a good giver, they've gotten funded. Now, it's only somewhere between 10 and 20% of the time, if you've only been a taker, has that been funded. And so, this reciprocity, it's what drives all communities, not just CrowdHealth. Like it's, if you're a bad neighbor and you come over and ask for, salt or whatever,
Right.
I may not have salt. If you're a good neighbor and you come over, I'm like, of course I have, salt or flour or whatever, right? Like what you'd ask your neighbor for. So, we're really trying to create a community here who are willing to help each other. And, like I said, it's been 20,000 bills so far, and 99.9% of them that have been submitted to the community for funding have gotten funded. That 0.1% that didn't get funded are from people who are takers and not givers to the community. And so their bill didn't get fully funded. So it's a really cool process internally and a really cool community to be a part of.
Now, you really hit on what it is that I wanted to, or the sort of the model that I've had in my head. You got crowdfunding, and everybody thinks of Geyser or GoFundMe or whatever, but you've actually taken it and turned it into a community. And that community relationship building that's inside that is kind of knitting all this together. Without that community, this wouldn't have worked without those community ties, would it? Or do you think it would?
I think we could have created another GoFundMe for just healthcare,
Right?
And I don't think that would have worked. I think you have to build the community. And look, your Bitcoin, and we've got something like 2,000 of our 10,000, maybe it's even more than that by now, of our community members are Bitcoiners. And so the other cool component of this too is like, look, I'm going to be asking money from people who are in my tribe. And so that also impacts, my consumption and, whether I go and shop for a good price on healthcare and a whole bunch of things that have enabled us to, am I willing to negotiate with the healthcare provider? It's like an ER visit. Like, do I just pay the bill and not worry about it, or actually, let CrowdHealth negotiate it for me, because that's going to reduce the price of that bill, and so I don't have to stick another Bitcoiner with an inflated cost. It totally changes the behavior within the community as well, because we're not sending a bill to United Healthcare, which I don't really care about United Healthcare. I'm sending the bill to other people in my community, other people in my tribe, and I do care about them. I want them to stack as many sats as possible. So, I'm actually motivated to act, like their money is my money in some ways.
Now, this is I've heard you and one other member of your crew on at least 3 or 4 podcasts, and I have yet to find a podcast where they're talking about CrowdHealth that dives into the following. You're talking about negotiation. Most of the podcasts that I've heard when y'all are interviewed Don't dig into that. And I think that this is the most important component to how CrowdHealth is not only functional, but is starting to become or has been very, very successful and will probably continue. And it's that negotiation of the bill. And
Mhm.
I want to know way more about that because, like you said, you had an $8,000 because my son had ear tubes too. He had the exact same problem. Couldn't hear, was always having a headache. You know, it was like
Mhm.
clearly having major problems. And he was an infant when
Yeah.
this occurred. And it's like I said, it's a 15-minute procedure. Luckily, you know, I was working for Texas Tech University at the time, Blue Cross Blue Shield, and they basically covered the whole thing. But that's not always the case. And in fact,
Right.
I came up, you know, I came up rolling sevens on that one. But that's not the case. And when you end up with these bills, because I've got a couple of them laying on my desk right here from some esophageal stuff, and I'm looking at this stuff going, I I can't even navigate this.
Right.
I'm not qualified as a patient to navigate what I'm actually being sent information wise. Can you please take us deep into the negotiation stage of what CrowdHealth does for their members?
Sure. I'll give you even a personal example. So, about a year, let's see, year and a half ago, I was sitting in Bitcoin Commons here in Austin, and I was on a similar Zoom call like this, and I was talking, and all of a sudden, I couldn't speak. Like I could not. My vocabulary went from like this to like this, so I could not put together a sentence. I thought that I was having a stroke. So I
Uh-huh.
walked out and I handed my phone to Parker Lewis, who many I'm sure who know Parker
Yep.
who listened to this. I said, Parker, call 911. And so he called 911. They came, they grabbed me, they took me to the hospital. And, over the course of, 3 or 4 hours, they found out that I was just having a migraine. But they kept me in the hospital overnight due to some administrative error on their end. So had to stay in the hospital. The guy who decided I had a migraine did not communicate that to the next guy who took over, and
Wow.
therefore it was too late for the neurologist to give me the sign off, and so I had to stick around for another 12 hours sitting in the hospital.
Oh
I
God.
uh, I sit there in the morning and I'm like, I had a migraine. Why am I here? They're like, you're right. You have a migraine. All good. We'll get you out of here quick. And so I was like, great. So, like 30 minutes after that, a physical therapist and an occupational therapist came in and said, hey, we just need to do some evaluation of you to make sure that you can get out of here. I was like, because they put me in the stroke unit.
Uh-huh.
And I said, I just had a migraine. I don't need any evaluation. Just let me go home. They're like, promise it'll take 10 minutes. So they had me put on socks, brush my teeth, and walk down the hall to make sure that I was okay.
Wow.
Fine. So I get the bill, and they charged me for, in those 10 minutes, they charged me 8 different visits, 4 OT visits and 4 physical therapy visits.
Holy.
And each one of them were somewhere between $250 and $400 a piece. And so, I'm sitting here, I'm looking at this bill. It's like, one, you didn't give me 8 visits. Two, you didn't, I didn't need these visits. And then on top of that, they stuck me with an IV for the entire time. And I asked the nurse, I was like, why is this IV in here? And she's like, oh, am I dehydrated? She's like, no, you're not dehydrated. I just am doing this because this is just what we do on the stroke ward. I was like, I'm not having a stroke. She's like, we're just making sure. And so for that IV, 1,000 milliliters of saline, which I can buy off of Amazon for $8,
Uh-huh.
I was charged $5,100 for that. So
I've
I'm
wow.
I'm telling you the story because in essence, what we do is if you go to the ER, you will send us a bill. You take a picture, or you take a picture of a bill, and through our app, we got back end tech that scrapes through that bill and says, okay, is this needed? Is this a fair price? We walk through it with you. And then we then can send on your behalf a letter to the hospital to say, listen, he didn't need an IV. He didn't need to stay overnight. didn't need 8 PT and OT visits. And by the way, he didn't have 8 PT and OT visits. And then on top of that, what we do is benchmark the prices to what a fair price is. And we will send that to the hospital and say, hey, for all of these reasons, this is not fair, right? And so through that negotiation, which we will handle for you, we're typically able to get these bills down by 75%-ish.
Mm-hmm.
So we take a very active approach in helping you navigate these bills and negotiate them for you. So we're able to scrape out all of the nonsense. One other quick kind of point here: about 70 to 80% of the bills that we get in are coded as either emergency, like, not to get into too much detail, but there's 5 codes that the ER will use. One from like minor, doesn't need to be in the ER, to 5, which is this person's about to die, we need to get them involved, right?
Mm-hmm.
4, so stage 4 and stage 5, between 70% and 80% of our visits are 4 or 5, which means they're like super critical.
Right.
The problem with that is that other data has come out to say 70% of hospital or ER visits are not needed, which means they're 1s or 2s. So if we're getting charged, our members are getting charged 70 or 80% of the time for the critical, most critical, or second most critical, yet 70% of the ER visits are not critical, how does that math work, right?
Right.
So we've seen the stage 4 be billed for a broken arm. This is not a 99284. This is not a stage 4. This is a
Right.
stage 1 or a stage 2. And so what these hospitals do is what it's called upcoding. They upcode to the highest possible level that they can get away with for billing purposes, where it's just not accurate. And so we help you figure out what's accurate and what's not. And so we've got a team of people that do that on our end. And again, all you have to do is upload the bill. We do all the work on the back end to help you with those bills to really navigate those better. In essence, what we do. And we actually have attorneys on our team to help you go through that and engage the hospital on your behalf. And the vast majority of the time, these hospitals are like, fine, you're right, we'll significantly reduce these bills. And so we take a very active approach in that.
See, this is one of the things when after y'all launched, I can't remember if it was you or it was one of your crew. We were talking about this before I hit record, but we had talked about, I had asked them a specific question about this negotiation stuff because nobody was really talking about that. And I can't iterate enough how much that is like the first burn down stage. Because without that, then you're passing on to the rest of the community a whole hell of a lot more that they got to take care of. And you guys are like going, well, no, we've got this value added thing here, for lack of a better term, where what we're going to do is we know these codes, we know what's necessary. We've got, and I guess, but the question I'm getting at is the people that are doing the getting on the phone or writing the letters or writing the emails, are they past professional healthcare workers that are able to negotiate this, or who are you? How are you doing this? What kind of person are you getting to do these negotiations?
Yeah, I mean, the person who's in charge of going through your bill was actually on the hospital side, on the billing side, and so understands all of these codes, how they work together, which codes go together, which codes don't go together. And so we've got people who understand these codes really, really well, because they're the ones on the hospital side trying to, upcode these. And this person
Right.
was basically like, I couldn't do this anymore. Like, in just my morality, I couldn't, do what I was doing. And so I want to be on the other side of things and actually helping patients get billed correctly, as opposed to getting billed maximally, which is what she was tasked with doing on the hospital side. So we've got professionals internally that understand this stuff. They understand this stuff way better than me. They understand this stuff way better than you, no offense, but
Oh,
like, this
no.
is like their gig to really understand what is going on within the hospital to be able to code these things. And she knows all the tips and tricks, that these hospitals pull to maximize their billing. So we put a stop to that. And our team is really, really good at it.
Well, there's no offense taken on my side because, as I said, I'm unqualified as a patient to actually look at the stuff I'm being sent by hospitals or doctors. And I'll give you like the same example because you were talking about coding needs to be in the emergency room because they're going to die all the way to doesn't even really need that. But
Right.
but those codes reach way deeper, like they get way more granular, right? Like Tylenol 3 is not listed as a line item. It's going to be something like 06412.
Right.
If I'm looking at my bill and I have the notion that maybe I'm being overcharged and I want to call my hospital and say, we need to negotiate this because I think I'm being charged too much. Well, automatically that IV that is $5,100, I can't see it as an IV. The information that I get sent is literally a list of codes.
Yeah.
And I can't read those, which puts me in a bad situation from a negotiation stage. And that's
Mm-hmm.
what I think a lot of people don't understand is that they're being forced into a position where they don't even think negotiation is possible because the language being used is something they don't speak. And that is
Yeah.
the easiest way to block somebody off from them believing that they can perform a particular task is to make sure that they don't understand or have a hope in hell of ever understanding what is actually going on. And that's why I get kind of, because this was one of the first things that I heard about CrowdHealth was the negotiation side of it. And the crowdfunding part was actually, for me, kind of secondary. Is like somebody who understands how to look at my bill and knows what happened, when it
Yeah.
happened, what I was there for, and do these things actually fit together?
Yep.
And I can't. I just wanted to make sure that we talked about that a lot because that's the way that I can pay. What is it? Is it $55 a month for CrowdHealth?
Yeah.
And that's the base layer. And then if a situation comes up for one of the other members, everybody gets an email that says, "Hey, this thing has happened. Do you want to kick in like extra money?" Is that how it works?
Yeah, it goes $55 to us. That keeps the lights on for Crowd Health, and then we ask you for up to an additional $140 if you're an individual, to help somebody else out in the community. And we'll only ask you, once, sometimes twice, but mostly once a month to help somebody else out in the community. So we're not, spraying you with 1,000 emails. It's just once.
Right.
And I say max of 140 because we only ask for, what the community needs that month. So at the beginning of every month, we kind of look at all the bills and make a projection and say, hey, for example, in April, I think we're asking for $85 a month of the 140. So
Uh-huh.
that additional $55 a month, you get to keep. You can do with it whatever you want to do with it. We'll never claw that back, but we just don't have enough bills in the system so that we don't need to ask for the entire 140. But that also allows us that if we get like a bunch of bills in the system, then we can take that 85 up to 140 because that's the max, so that those bills can get paid. But we've only asked for the max 3 times in the last 4 years, so it
Yeah.
doesn't happen very often. And that's we're situations in which we had a bunch of NICU babies all at the same time, and so we had to ask for 140. And then when those bills got paid, we went back down to something significantly lower than that. So that's the beauty of this, where there's no big pile of cash on the back end to pay these bills like health insurance plans. And a lot of people are freaked out about that. But as Bitcoiners, we know like that pile of cash is losing value every single day. And
Right.
so we prefer you to have that money so that you can stack sats or do whatever you want with it, so that you actually get value out of that, as opposed to it melting away in this big pile of fiat on the back end. So that's just our model. And like I said, it's worked super, super well over the last 20,000 bills.
Well, I was thinking about that, and I came up. I was on a walk before this because I usually try to develop the questions very close to the actual interview. It's probably a bad habit, but I started wondering about that. and it's not just about where Bitcoin fits in. It's more about, do you guys have enough data where you've done like a model of the maximum potential payout versus the number of users in your system? Have y'all looked at anything like that? Like worst case scenario types issue given how big your network is?
Yeah, I mean, so the interesting thing about what we do is that I'll give you one quick example of, a really big bill, and the way that it works with big bills, because it's very different from the way that big bills with health insurance work. We had a guy who was in Montana who was out fishing, and he was in bear country, wolf country, and so he had a 44 in his holster,
Mhm.
and he caught a fish. He leaned down, the gun fell out of his holster. It hit the hammer perfectly and went off. It
Oh,
went into his calf, out the back of his calf, into his thigh, out the top of his thigh, into his chest, and out the back. Now, this guy was in the middle of nowhere. He was about 2 hours from the closest hospital.
oh,
So a helicopter had to come in and pretty much pick him up off the side of a river, take him to the hospital. He was in a coma for a while. They thought he was going to die. They wouldn't let him drive home to California. So, he drove home. He got sepsis on the way home. And so he was in sepsis for, I think, weeks. And so, this is one of those bills that's a monster. I mean, just an absolute monster bill. But
right.
this happened in July. We found out about it. And so we started crowdfunding for this in August, September, October. We started finally getting bills in October. But by that time, it's already 3 months past. We had already crowdfunded a bunch of it. And then, it takes typically 3 to 6 months to negotiate these bills. So we, continue to crowdfund in October, November, December. And so these big bills typically are stretched out over a long period of time, and therefore you don't have the huge variations in kind of month to month expenditures. You can see them coming, and so you can crowdfund accordingly. And so that's how we deal with some of these, really, really big bills, because we can kind of stretch that crowdfunding over a period of time. And so those spikes are much less, large, when you can deal with it in this way. And even some of the big things that people think about, like cancer cases, for example, and we've had dozens of cancer cases now, and including some really bad ones. I mean, we have a member, unfortunately, who's struggling with stage 4 lymphoma. We've had melanoma. We've had a bunch of breast cancers. We've had colon cancers, cervical, uterine cancer, all kinds of different stuff. Pretty much any cancer you can think of, we've dealt with it. Leukemia. Um, and so those are big expenses, but they take place over a long period of time,
Right.
right? And so it's not like you have these big variations in funding requirements from month to month. And so, like I said, and we're still only, on average, we've only asked over the last 12 months 100 of that 140. And so we're still, whatever that is, 30% or 35% below what our maximum is. And so we can always lift it to that maximum for a period of time to get those bills paid, and then lower it again when the bills fall off. So it's
Right.
just a totally different way of thinking about these healthcare expenses than health insurance plans. And like I said, we've had huge, huge bills pop up. NICU babies are our biggest. These babies can be in the NICU for months at a time, and hundreds of thousands, if not millions of dollars. And as a result of that, we can start crowdfunding as soon as we know that this big health event is happening. So that by the time they get the bills, we've had most of that crowdfunded, and then we can crowdfund it up to 3 to 6 months later. And so it gives us some time to get those paid out. And so it's worked really, really well.
Well, because I know that that you guys, that Bitcoin is part of what it is that y'all do, but y'all aren't actually leveraging Bitcoin on the back end like you're keeping it on your books for, I what am I trying to say, like an expandable bladder. Like you're saying like healthcare companies have massive amounts of fiat just chilling out, and if something happens they just draw off that pile or whatever.
Yeah.
Are you guys doing that? Are y'all keeping Bitcoin on your books at all in the same kind of way for the same kind of reasons, or is it just flow through?
Yeah. I mean, we have Bitcoin on our books, but it's not to pay bills. It's just
Okay.
for a corporate treasury strategy. And we do not use Bitcoin to get those bills paid currently. The only Bitcoin play right now is we have a lot of Bitcoiners, and the excess funds that I was talking about. So we
Uh,
can ask you up to 140, but we're only asking you 85 this month. That 55 you can contribute, but that 55 goes directly to a Fold account that you start and
mhm.
converted to Bitcoin right away. So that excess can basically be auto kind of converted to stacking sats. And so it's just been a good way for our members to, stack every single month, in more of an intentional way. And ultimately what we want to do is I'm a Bitcoiner and I want to change healthcare too. So I'm trying to kill two birds with one stone here. But ultimately what we want to do is create scale within the Bitcoin community, so that we can actually start funding each other in Bitcoin as opposed to dollars. We're also on the other end getting a database of doctors and even some hospitals now who will accept Bitcoin as payment. And so if we can have the funding and the payment done in Bitcoin, that creates Bitcoin circularity within the healthcare space. And I'm a huge advocate of Bitcoin circularity. And so if we can do it within
Yeah.
the $5 trillion healthcare space, then I think that goes a long way of getting, Bitcoin circularity and some of the other industries. And for most of us, healthcare is our, either number one, two, or three expense line item on our, monthly, personal budgets. And so if we can take one of those huge line items and transition them to being paid in Bitcoin so you can get out of fiat in that line item, we think that's a huge, advancement in Bitcoin usability and using it truly as a medium of exchange. So that's what I get really excited about. I need scale to do that clearly. So I'm trying to reach out to the Bitcoin communities. Like I said, I was on Saifedean's podcast yesterday, trying
Yeah.
to get more Bitcoiners signed up, because if we have that scale within the Bitcoin community, then that circularity is the next step.
Well, you mentioned getting doctors into the network, or rather, doctors. Make sure I make sure I say what you said. Not getting doctors in the network, but getting more doctors to actually accept Bitcoin for their services. And the question that I have is, I kind of want to go back to like what I accidentally said is are y'all actually looking at getting doctors into, for lack of a better term, y'all's network, where you're working with a specific set of doctors where you can send people in the community to say, this is your guy? Or is it just, we just want to get as many doctors as possible to take Bitcoin?
Yeah, I mean, I think that we have to define network. Network is defined within health insurance is here's the set of doctors you can go to.
Right.
You cannot go out to any other doctors, because if you do, then you basically have to pay for it, right? So we do not have a network of doctors that you have to pay. What I'm trying to do is provide you with more of a marketplace to say,
Yeah.
hey, if you live in Austin, Texas, then and you need a primary care doc, here are 10 primary care docs in Austin, Texas that accept Bitcoin. You know, Go and choose one of them, or you can choose another doctor. I don't care, but we're just trying to give you information so that you can be truly sovereign in your healthcare and choose who you want to go to. And most Bitcoiners want to go to doctors who accept Bitcoin. I mean, that means they generally have the same worldview on some of these self sovereignty issues, and therefore want to be a member of their practice. So we're
Right.
just trying to give our members more information.
And that is what I mean by network in this case. Like I said, for lack of a better term, and I definitely don't mean in network versus out of network, as much as a network of people that are connected together through some common goal, which does not preclude somebody being able to go outside that network if they want to have their own doctor, then or their own hospital or whatever. The negotiation team is still there, and I think that that's really important to iterate that in network out network is definitely not part of what you're doing. But I keep seeing all these doctors on, like Dr. Sean Baker.
Yeah.
There's a whole bunch of doctors on Twitter. There's a whole bunch of doctors on nostr and a lot of them understand that most of our health issues are coming out of like really bad nutrition. We already talked about the fact that we've damn near destroyed our agricultural system top to
Yep.
bottom.
Yep.
And we've done it in several different ways, but nutrition is definitely one of them. But I just keep thinking, like having these people as like part of what you guys are doing. And I guess the example that I had was like, could CrowdHealth integrate health professionals that are aligned with sovereignty and nutrition, and possibly, allowing, like, let's say that some of these doctors have a paywalled blog. You could read about their like what they think about nutrition, or like, like they have like extra things that they can give, but what, they don't want to give it away for free, to be able to work out a deal with these doctors to come into CrowdHealth and say, somehow or another, we're going to partner up and you're going to give all of your stuff to our customers. I as a customer of CrowdHealth would be able to reach beyond any paywall for any of these doctors that have extra information on nutrition, carnivorism, keto diet,
Hmm.
anything like that, because I know they exist out there. And
Yeah.
I just wonder if those kinds of networking opportunities are considered in, within what you guys are doing is in your business model or not. I'm just kind of like reaching for stuff here.
Yeah, no, I mean, I love, Dr. Baker. I've been on his podcast twice now. The carnivores kind of right behind the Bitcoiners, are our second probably largest contingent in the crowd health community. But we have not like reached out and asked for special access to them or anything like that. I mean, I think there's probably opportunities to do that as we scale up. If we've got 500 people in Austin, Texas who are looking for a carnivore doc, I what we are hearing from doctors is I want more people who pay me directly as opposed to, me
Right.
billing through health insurance. And we get dozens of doctors every month. I think one week we had like 50 or 60 doctors reach out to us. And it was
Wow.
like, I want to I want to be a part of whatever database you have, because if I have crowd health members in Austin, or I don't care where, Minneapolis or Topeka or whatever, like I would love for them to have access to me because I have the same worldview as them. So, it is a network per se, but network more in terms of like a business network where you need the buyers of the service and the sellers of the service both to come together in a marketplace. And if I only have one person in Austin, Texas looking for a carnivore doc, then the carnivore doc is like, okay, that's great, but like I need scale on my side too. So I need both the buyers and the sellers to get together on a marketplace. And that's in essence what we're trying to do is create some scale so that we can have doctors in Austin or Minneapolis or Topeka actually provide services to only carnivores, because now we have the scale to enable them to do that financially, so that they can ditch United Healthcare altogether. They don't have to deal with that nonsense. They don't have to deal with the billing component of that, and they can get paid directly by their members. I mean, that's my ultimate goal, is to give doctors the ability to escape the system and get paid directly from our members. And I think we're going to be able to do that with some scale.
Well, just to be clear, you guys are available nationwide. I mean, it's not
Yeah,
just Texas, right?
yeah, we're in all 50 states. Puerto Rico, DC, U.S. Virgin Islands, anywhere. And in fact, you can even live outside the country as long as you are able to get a U.S. bank account. Because one of the things that we do when you sign up is you sign up for a bank account, and that's
Right.
how all the funds are transferred, is through the actual bank, because we can't actually transfer funds. And we don't want it to touch our balance sheet because we just don't want to touch the money. So
Right.
you can, and actually I think Saifedean is a member. He lives in, I believe, Lebanon. And he's a paying member of CrowdHealth, even though he lives in Lebanon, because he has the ability to get a U.S. bank account. So we've
Okay.
got probably a couple hundred members or something like that actually live out of the country. The other great thing with CrowdHealth too is, if you're traveling, you can use CrowdHealth wherever you go.
Yeah.
So you don't have to get travel insurance or anything like that. We had a guy who got bacterial meningitis when he was in Japan and went into a coma and
Ooh.
submitted that for the community. So, you can use CrowdHealth wherever you are, regardless of where you are in the world.
Well, we were talking earlier about the negotiation part, which I still believe is a critical
Sure.
issue here. So I want to throw out a scenario here. Let's say that I don't have health insurance, but my wife works for a university and she has United Health, like one of the big four. All right. And I decide to go ahead and sign up to CrowdHealth. Is it possible that CrowdHealth would be able to, like, let's say that I'm on her, I would be on her insurance. Like, so I would be covered on my wife's insurance through United Health. Something happens. I get a stupid bill, but I'm also paying for CrowdHealth. Would CrowdHealth be able to or willing to negotiate that bill down, even though what it ends up getting left is going to end up getting paid for by the other insurance company? Is that even possible?
Yeah, we have about 20% of our members who also have health insurance. And most of them are just trying out CrowdHealth to make sure that we're legit since we're so different. They're just not, fully trusting that we're going to be able to get it done. But we've helped members do that before. Yeah. So if you have your current health insurance, we can definitely, we're best in taking a look at those bills and being like, yeah, that's not the right code, or this was, not, if a female is born and gets a circumcision, clearly there's a problem there. Like we can
Right.
look through those types of things.
Right.
It's harder to negotiate the price down because you're in bed with United, and
Okay.
United has a contract with whatever hospital your wife works at, and that hospital is obligated to pay that, to get that price because that's what United has actually negotiated with them. So it's harder. It's not impossible, but it's way easier for us to negotiate if you're with CrowdHealth and don't have health insurance because there's not a pre-negotiated rate already.
Okay.
But we can absolutely still help. We had a member who got a 5 ER bill, per talking about before,
Right.
and because her daughter was dehydrated and went in and got fluids, and we were able to help her get that down to a 3 instead of a 5, right? And so that was several $1,000s of negotiations that we were able to get down. But the member still had to pay whatever. I think this was Blue Cross Blue Shield, still had to pay whatever Blue Cross Blue Shield's negotiated rate was because she used her insurance as opposed to using CrowdHealth.
Uh-huh.
And we're getting about 50% better prices than the big insurance plans for these large bills. So,
Okay.
it's just an inefficient way of doing it. But the other thing we can do too is help you fund your deductible. So anything that the health insurance plan doesn't pay, we can submit to the community to pay. So if you have got like a Obamacare plan that's $14,000 deductible, we will be able to help you fund that $14,000 deductible because the health plan won't pay it. So that
Wow.
is one of the reasons why our members would use CrowdHealth.
Yeah, that's a huge thing. So you got a discount for members who are metabolically fit. Could you say a couple of things about that?
Yeah, it's interesting with health insurance, unlike other types of insurance, if you have homeowners insurance and you live in a place that is prone to natural disasters, you're going to pay more.
Yeah.
If you have car insurance and you're a bad driver, you're going to pay more. For health insurance, it's actually illegal for people to vary rate depending upon how healthy you are. This is another government regulation. And so, what we do is basically, we're not health insurance. And so we
Right.
can, give people better deals. And so as of right now, we give you a 10% discount if you're metabolically healthy. So you either have to submit an insulin, a fasting insulin. I think it's under 5.5, or if you are in the bottom 25% of people with visceral fat. So your visceral fat levels are really, really low. And
Right.
just for those listening who don't understand, visceral fat is not necessarily the fat around your belly. It's the fat that's like hanging out in between your organs. And that's the
Ah.
stuff that creates really bad chronic conditions. And so we'll give you a 10% discount on CrowdHealth if you fit into one of those categories. Starting in Q4, that will go from 10% to 20% if you have both of them. So if you can show us a low visceral fat and a low fasting insulin, we'll actually give you 20%. I'm actually trying to add a third
Right.
component, which is whether you can squat 1.75 times your body weight,
Yeah. Yeah.
which means that you're actually like doing what you need to do to take care of your body. I mean, 1.75 is a lot, but it's one of these things, like, I want to incentivize people to get stronger, healthier, because ultimately I want you to live your best life in your 70s, 80s, and 90s. And if you're metabolically unhealthy in your 40s, 50s, and 60s, then you're not going to live your best life. I want you to die fast instead of die slow, if you know what I
Right.
mean.
Right.
Nobody wants to live the last 3 or 4 years in a nursing home, having somebody else, with a tube stuck into you for feeding, right? Or,
Yeah.
somebody have to take you to the bathroom. Nobody wants to live that life. And so we want people to thrive through their 70s, 80s, and 90s. And I think metabolic health is the clearest way of getting there. So we're giving people discounts for being metabolically healthy.
And you guys have also inked a deal with Fold, right? Because we were talking
Yeah.
about that a little bit earlier today. You want to say something about exactly what is it? Just that I get a Fold Plus membership with CrowdHealth?
Yeah, you get a full plus membership, which
Nice.
currently is about $100 a month or a year, and so we will pay that $100 a year for you. And as a part of our kind of crowdfunding component, any of those excess funds go directly to Fold and then converted to Bitcoin. So you're intentionally stacking Sats in addition to paying for your healthcare. So you almost have like a little Bitcoin HSA, on the side. It's
Right.
not an HSA, but it kind of
Right.
feels like that, right? Where you're stacking for something big happens in the future. And we don't have any access to that. That's totally on your Fold account. You can use it for whatever you want. But I just kind of, the way I think about it when I put money into that account is like, yeah, it's my little mini Bitcoin HSA over here that's growing in value as opposed to melting away in fiat in some other HSA.
Awesome. And I want to keep this at an hour because I know you got stuff to do. You got a book coming out.
Yeah.
What's the name of it?
It's called Fiat Medicine.
Nice.
And it is going to be published by Saifedean's Safe House.
Uh-huh.
I'm writing it with Matt Lyshak, who also wrote Fiat Food. So the two of us are putting together a book that should be out late summer, early fall, called Fiat Medicine. In essence, what it does is, as we started the conversation, kind of walks through the history of healthcare and why it's so screwed up and all these government interventions, a lot for, consumer protectionism, but also for profiteering. And then
Yeah.
Matt takes us up to the current state. I talk about the current state and then what healthcare could look like going forward. And I think it's a great read. So we'll let everybody know when that's out, but it's right around the corner, and I think it's going to be a fun read for folks.
So y'all are almost finished with it?
Yeah, we're on our second draft with the editor right now, and I think we're probably 2 or 3 weeks away from that being finalized. And once it's finalized, it heads out for publishing, and that takes a couple months. And so I think at the latest, we're going to be beginning of the fall, more likely end of summer.
Okay. Well, for all those that are interested in reaching out to you, how can they get in contact with you, and where's the best place that they can go find more information about CrowdHealth?
Yeah, and all the social media accounts is Join CrowdHealth. You can keep up with us there. That's probably the best way. Joincrowdhealth.com is our website. If anybody's a Bitcoiner out there, which I know a lot of your listeners are, use promo code Bitcoin, and that'll give you $99 for the first 3 months, which is about 30 or 40% off of what you normally would pay. And we'd love for you to join us. More Bitcoiners, the better.
Yeah, I have to agree with that one. Well, Andy, I can't thank you enough for clearing up some of the questions that I've had for 3 years, honestly, because I've been wanting to ask somebody, like have an in-depth discussion about this for a long, long time. And I can't thank you enough for spending your time here on the Bitcoin and podcast. Is there any parting shots that you want to take? Anything else that you want to leave the listeners with?
Yeah, I mean, I would just say, as being somebody in the Bitcoin space and trying to build a Bitcoin company, I think one of the biggest things is that, and I spent the last 3 years at the Bitcoin Commons amongst people who are entrepreneurs trying to buy Bitcoin companies. It's just support Bitcoin companies. I mean, everybody needs scale to do this well, and so in any way you can support Bitcoin companies, go and do that. Because we need more and more people on some of these services to make them really, really great. So that's just my one push for Bitcoiners to kind of get involved in the Bitcoin space and support those of us who are trying to build Bitcoin companies.
Is that what where you're at right now? Is the Bitcoin Commons?
I'm at a different location today.
Okay.
But yeah, normally I'm at Bitcoin Commons, which is, a ton of fun to be around those folks.
Yeah, I haven't been to Austin in a long time, and I certainly haven't been there since Bitcoin Commons came up. So I don't know where it is. I presume it's behind you somewhere.
It is. Yep.
Yeah, I kind of figured. All right, Andy. Well, hey, listen, man. Again, thank you so much for being here, and we'll talk to you later.
Thanks, brother. Thanks for having me.
This has been Bitcoin and I'm your host, David Bennett. I hope you enjoyed today's episode and hope to see you again real soon. Have a great day.